Hello, my name is Juana. I am a children's social worker, a healthcare advocate, and one of the founders of Looms for Lupus. Looms for Lupus is a nonprofit organization that illuminates, supports, and empowers those living with lupus and overlapping conditions such as fibromyalgia and mental health. I was diagnosed with lupus in 2009, soon after being diagnosed with rheumatoid arthritis. However, I now truly believe that my symptoms started since 2004 after being diagnosed with hypothyroid. From 2004 to 2009, I knew something was wrong. I went to the doctor several times. However, they always said that I was fine. In 2009, I knew something was really wrong. The mouth sores, the pains, the headaches, and my hair was falling was extreme. I went to the doctor. I was told that I was fine, that I looked fine. I insisted, I persisted about getting lab work to know what was wrong with me. I knew something was wrong. After lab work, the doctor talked to me and said I was critically ill. I was told my platelets were low. I didn't know much about what platelets were, but I knew that platelets below 100 were not good. My platelets were at 6,000 or 6. I was then admitted to ICU. And a few hours later, my platelets dropped even lower. They dropped to 2. I was then diagnosed with lupus. The doctor said they couldn't do transfusions because my body was attacking itself. Diagnosed with lupus. I now say that I am an advocate, not only for myself, but for others. I share my personal story to empower others on the importance of advocating for yourself. I am alive today because I insisted, persisted, in asking the doctor to check me because I knew something was wrong. I truly respect the doctors. They're the professionals, but we as patients are the CEOs of our bodies. We know when something is not right. With all the respect to the doctors, we know as patients that if we are not okay, that something is wrong, we need to be heard. We need to be acknowledged. We need to be checked. The relationship with your doctor is important. Working together for a treatment plan is important. As a patient, I can say that having that communication, that relationship with my doctor makes me feel better to know that I am part of my treatment plan, and that helps me to know that I also have the power to choose what's best for me. From this meeting, I say that we learned about not only tools that help us to better communicate with a doctor, but we also learned about the different terminology, the different information that can help us, not only with being prepared to meet with our doctor, but also to help us understand the many side effects that certain medications can give us. I just want to remind everyone, we are the CEOs of our bodies. We know when something is not right. We respect our providers. We respect our doctors. But they need to understand that when we, as patients, say we're not feeling well or something is wrong, for them to work with us.